presentation, I chose to do physician-assisted death, and the history behind it is that it has been used back since the 5th century BC. The negative connotations and the negative views come from Dr. Jack Kevorkian, who ended up assisting more people in death than he needed. They weren't terminally ill, which means they could have gotten better. And then people are more emotionally pushed to take these actions when there's heavy stress around. Misconceptions are that all of the physician-assisted suicide started in 1993, and that Dr. Jack Kevorkian was actually a positive person. The only thing that was positive he did was bring it into the public eye and make it more known than before. Counter-arguments is that it violates the Hippocratic Oath for doctors. The only part that has recently kind of become into question is the fact that it was revised in 1964, and the revision says nothing about this type of assistance. Religious beliefs will prohibit suicide or the killing of someone else, which on both sides, the doctor and the patient, could result in the afterlife views of religion. Families or patients could give up too quickly is another concern, that if someone isn't far enough along, they argue that miracles can happen, and they don't want people giving up too soon. Legalization, it's legal in 3 states. It's legal in Montana, Oregon, and Washington. And it's legal in 9 countries: Switzerland, Belgium, the Netherlands, Luxembourg, Norway, Finland, Albania, Holland, and Thailand. The laws: one must be mentally competent, meaning they can make their own decisions. It must be written down and signed by the patient. They must be terminally ill, which means that they will not get better. They have to seek a second opinion from a doctor on this in order to be able to go through with it. And it has to be humane medication, meaning that they drift into a sleep-like state and then pass away that way. And I know that in the state of Montana, they have to do it, they have to administer the medication themselves. So they're given the medication by their doctor, and they must give the medication to themselves. A reason for physician-assisted death is that disease and cancer can cause prolonged periods of pain and suffering. In my eyes, I don't see a purpose for suffering, like for your pets or even, your great-grandma or someone like that. Suffering isn't acceptable. Most people with a disease or cancer in the end stages will live 6 months with excruciating pain, with vomiting, coughing, spasms, and incontinence. And the physiological or the psychological suffering that they go through with knowing that their time is coming is sometimes too much for a patient themselves. Dignity. Most want to die with a sense of dignity. Their loss of physical ability to vomit, drool, urinate, and they are basically incontinent. Other people have to take care of them. Other people are caring for their physical needs, and most don't like that. They want pride and self-worth as they go out the door, and the memories that they want their loved ones to remember them all by is by the person that they once were, the healthy, the lucky person that they once were. Another reason that makes this a positive thing would be for organ donations. There are really long waiting lists for heart, kidneys, and livers, and a lot of other organs. And they'd be able to save all of these and eventually save a life because of this. I know this from personal experience because my great-grandma passed away a few years ago before this was legal in Montana. And she wasn't able to choose this option, although I'm not sure that she would. But from personal experience, it's the hardest thing, watching someone that you love die in excruciating pain. Thanks.